Now like to welcome up Jordi Pierre from Catalonia. Jordi is the Digital Health Strategy Officer or Director of Digital Health Strategy, I believe, for Catalonia. So welcome to the stage, Jordi. Come and join me. So first of all, it was your birthday yesterday. Happy birthday, and did you have a good birthday?
Yeah, you will notice by my voice, we ended up a bit late.
So you had a good birthday.
It was long and a good one. Yeah.
Wonderful. So we made it here. Congratulations on making it here, and I'm glad you enjoyed it. So all eyes are on Catalonia because people are finding it really inspiring how you're choosing to, so I would describe it, engineer healthcare data and systems for the future. What do you think you've done differently there?
Well, Thomas was mentioning it before. In Catalonia, we have a long tradition of sharing information all across the public ecosystem. Since year 2007, for all the public sector, we have a shared electronic health record. And we like to say, or what our reflection was some years ago, that we have achieved everything that can be achieved through interoperability. We have connected all of our systems. We have a care process management tool also, which is helping in between referrals, between providers. And the only thing we now do is just keep connecting more and more things and connecting more and more silos of information. So our reflection process that we conducted was in line of, well, we need to stop at some point this fragmentation. That's the challenge that we find out. Every time that someone is developing a new application, a new system, they use their own proprietary standards, and every time it requires an ad hoc interfacing. For us, in a public healthcare system, beverage model, where you have a unique insurance, for us, interoperability is no business. For us, healthcare is no business in general. Obviously, for all the industry partners, they are very happy to keep plugging in things. But we think that that's not the way to go. In fact, we analyzed our ecosystem, and our calculations were that we have around 16,000 different silos of information for all the population we serve, where the data of our citizens, which is 8 million people, is split among. And what we are doing, we are in this maybe crazy adventure of rebuilding all of our systems, removing the legacy, and moving towards what we call an infrastructure, which is basically what Thomas was explaining before. It's putting really data in the center, having some common data models, some common terminologies to represent the healthcare domain, and socialize this with all of our ecosystem. This means industry, service providers, organizations, startups, everyone, so they can plug their solutions in there, and we speak the same language, and this then will enable easier usage of this data, because at the end, what we want, all of us, I think, is that this data, this information, this knowledge that emerges from all the data that we collect arrives to the right stakeholder within the value chain at the right time, right? And sometimes we are not yet there, and we think that we will achieve so by proceeding in this way.
So I'm really taken by that concept of infrastructure being the game we're in, as opposed to infrastructure and systems, yeah? The infrastructure is, would you say that's a summary of the aims of the procurements and the programs that you're running at the moment? Is it putting information as the primary thing you're designing, and then the systems must fit around that?
Mm-hmm. Yeah, we have this digital health strategy that obviously has, many different strategic lines, and you have all the buzzwords in there. You have the AI, the telemedicine, the blah, blah, blah. But if we had to define it in one way, is that it aims to build this infrastructure. And if I can use the words of a very wise woman that I know, and it's by a matter of a chance, sitting next to me, she said once, if we consider that data is for life, we will design and procure systems differently. So that's what we are doing. I mean, in all the procurements that now are emerging from the public sector, from the Catalan NHS, all this concept of the infrastructure, the open repository with the common data models is coming in all of our procurements, and this is making all of our ecosystem to be reshaped. So our industrial partners now, they start to speak the same language. They are training their people, and we have the feeling that we are starting some movement in here that will help us move towards that, because obviously we cannot do that alone. We need to convince everyone in our ecosystem, and I think that that's what we are doing.
Wonderful. And yes, thank you for that quote. You mentioned skills as well. And in order to do something that is right for the system, you need to be the intelligent client. You need a set of skilled people. Mm-hmm. You know, how do skills enable you to undertake a sort of digital health strategy like this? And what's your view? We heard time and time again from the different speakers that have gone before that across the world, skills are a rate limiting factor. What are your views, and do you think you will be looking to address that?
Yeah, that's a good one. I mean, I think that we are facing all the same challenges with workforce and with the capabilities or the competencies that this workforce needs to have in order to undertake this transformation. We also have a very good example in the NHS, which is with the Digital Academy, and that's you. Where you have been training the leadership, I think building on this motto that if we want to transform the healthcare towards more digital, we need our leadership to understand what all these buzzwords mean. The leadership of healthcare is normally healthcare professionals that they haven't had the training or the skills in this specific environment. So we are trying to proceed in the same way. So we are trying basically to copy your strategy, and we are taking advantage of all the massive funds that we've been talking about that are coming from the Recovery and Resilience funds from the European Commission, to start training our workforce. We also want to start training the leadership, because I think that's important, because they can be really the drivers of change. And then on a second iteration, I would say, we will go into the second level and professional staff to do such.
That's great to hear. And certainly I know in the UK, Chime, the Academy and other things have been used to actually raise the digital readiness of the workforce. And I think that's really interesting. And you mentioned there that you were going to be spending some of the resilience money, this really large pot of money that is being given out across Europe for skills. What other priority areas are you going to use that money for in terms of the recovery from COVID?
Yeah, I mean, the amount of money that is coming everywhere is in Europe, as mentioned before, is massive. And that's, I mean, crazy what I'm going to say, but we have too much money right now, and we have to spend it in really in a very short period of time. And I would say there won't be enough consultants or capacity, at least is what I'm seeing in Spain, to be able to spend this money properly. That's my first statement around this. The second one, to our best capacities, we are trying to spend this money the best as possible. So for us, I would say one key thing that we are using it for, it's linking it with our strategy. We are putting in place a program that will help us build all the clinical models that will sustain our new system for ambulatory care. We are doing this jointly with, we aim to do this jointly with other regions in Spain, because what we are trying to do is to scale up our ideas to other regions in Spain. You know, we are just one of the regions, a big one. It's 8 million people, so it's bigger than, I don't know, Denmark, Finland, and full countries. But we have bigger regions in Spain. I don't know, Andalusia is 12 million people, for example. In fact, Spain has, as it has 17 different healthcare systems, one per region. Well, we are joining efforts with them in this clinical modeling effort to try to see if we manage to do such. But then there are other strategic priorities. So from the pandemic, we realized that we needed stronger control of our ICUs, for example, and now there's a big project that will merge all the information that is coming from all the ICUs into a single one, with this fancy command center, big screens like, I don't know, NASA style, where I guess there will be people looking at them, and I don't know what decisions they will be making, but that's another one. We are thinking also the chance to rebuild all the public health system and all the epidemiology part. I mean, that was, with the pandemic, we also noticed that was not strong enough. So we're having a problem which is called public health intelligence, and there we will put a lot of money. But then there's a lot of other things. So there's projects on telemonitoring, there's projects on telemedicine in general, there's things on mental health, there's a lot of money to be spent that truly we are struggling on spending it.
Yeah, and I understand that problem. Certainly in the micro, we had that when I was a CIO, of money suddenly being available end of year and it not being spent particularly wisely. When it all comes and has to be spent with a time limit, sometimes you're not making the wisest decisions across a region or a country. So my final question to you is, what other parts of the world do you find interesting in terms of the policy strategy or sort of development? Where else do you look to and think there are interesting things happening?
Well, I like the idea of the integrated care systems in the UK. I think that this is something worth looking at. I have this tendency to look only to systems that are such as our system, which is a national health system, as I said, with just one insurance, free healthcare for everyone. I think that the strategy of the ICS it's interesting because it's merging all the different healthcare devices across the territories and trying to merge the provision into a single one. But I think what it would be very, very, very interesting to look at and see how it evolves is the big healthcare reforms that the people in Finland are undertaking. These guys, what they are doing is merging all the different healthcare provisions into a single one. So basically, they had before now, well, right now they have primary care, which is lying in the municipalities. Social care is lying in the municipalities. Then they have hospitals. Then they have residential care. Well, they are killing all of this and making everyone into the same organization. So this means really changing the way you fund healthcare. And I truly think that, as in every other business, I would say, the model follows the money. So if you have a model where you are paying for hospitalizations or for discharges, you will have amazing hospitalization units and physicians and nurses that are very proficient in hospitalizations. But if you merge all the provision into a single one towards making it more longitudinal, what you will see, and you pay in this way, we will see more collaboration. I think that we will be able to break the classical separation of the healthcare levels, also with the social part. And I don't know, I think that this will be of, I mean, it's crazy and it's super difficult what they are doing, but I think it's worth learning and seeing what happens, because this can be a game changer.
Well, it's good to know what you're watching, because that means we should be watching it as well. So thanks so much, Jordi, and congratulations again on everything you've achieved, because I think you are building the next generation of digital health system in Catalonia. So if we could give a round of applause, please, for Jordi.
Thank you.
Thank you.